Hey guys, Kevin Runlet with Runlet Law Firm. You know we handle workers' comp, work-related injuries here at Runlet Law Firm. And today I want to talk a little bit about carpal tunnel syndrome, how that happens, and what you can expect in a workers' comp case if you have that injury. But first of all, we would really appreciate it if you'd hit that subscribe button and that like button down there below, and helps us out a lot. So let's get into carpal tunnel. Carpal tunnel is something we see quite frequently in Mississippi with work-related injuries. We have a lot of chicken plants where people are using their hands all day when they're on shift. You see this a lot with people who have to type all day. What happens is tendons and ligaments in the hands, just from overuse, seize up. So the first thing you need to know is what's the date of injury? Well, this is actually considered a cumulative injury. So as opposed to, say, an accident where somebody fell down, there's a set date when that happened. You know exactly when it happened. You know how the injuries occurred. Sometimes it can be a little bit tricky with a carpal tunnel because you might start feeling some pain and not report it, and then over time it gets worse and worse till some point you just have to tell your supervisor, my hands just are really hurting. So it's a little bit more difficult, but you don't necessarily have to have a specific date in this instance because it is something that happened over time, and we do see some types of injuries that are in this category. So that doesn't mean you don't have a claim. So if you're working on the job and you experience these problems with your hands, sometimes people's hands even seize up where they can't use them at all. It's a scheduled member case in most instances, which means the laws that we have for workers' comp say this is a hand injury and you're entitled to 150 weeks. You may argue that it's also an arm injury, which would be worth more than just the 150 for a hand. So you need to let your attorney look at that and kind of help you decide how you argue that, and they can help you get the most out of the case in that circumstance. So how does it work? Well, just like all of the workers' comp injuries, once the claim is reported, you should start getting treatment from a doctor that you agree with. You should, if you're off work because of this, you should start getting 2/3 of your average weekly wage. Usually they send those checks every 2 weeks, but you got to watch them. They'll miss those checks. You'll fall off their schedule. This is where an attorney can help. We have people on our team that monitor that, and if somebody's check doesn't show up, we're on it. Where's the check? Where's the check? And they usually end up getting it to us pretty quick. So you'll treat with your doctor. You may have to have surgery, and then at the end the doctor's going to say, well, I think you're as good as you're going to get. So what needs to be looked at that point is how does that affect your job duties? And I've talked about this in other videos, and it's relevant to all types of injuries, is how does it affect your ability to do the specific job you did? So if you only typed for your job and you lost use of both hands, you would be totally disabled and you couldn't do that job. So the case would be worth more. If that's not the case, then it would be worth less. So you just have to really look at those things and talk with your attorney about, how does this affect what your job duties are? It's going to help the situation. So hopefully this helps, and if you have any questions, we're here to help always. Appreciate you watching.